Okay, Mr. Smith, I've done all the tests that I need to do today. I've had a good look, obviously, at both your eyes.
Yeah.
Now, I'm actually finding some changes in your eyes that I'd like to refer you to the hospital for. Now, let me just run through what I found. The test that you did, well, you know where you counted the dots and asked you to count how many dots. In your left eye, absolutely fine, no problems there at all. The right eye, there's a couple of dots, a couple of lights that I showed you that you didn't actually see. Only a few, only a couple of them, and we did double check them.
Right.
And the puff of air test that I did, where I checked the pressure in your eye.
Yes.
Again, your left eye is absolutely fine. The right eye, the pressure's a little bit higher than I'm happy with. Not very high, just slightly higher than normal. And when I looked at the back of both eyes with the bright light, do you remember the test I did earlier?
Yes, I do remember.
Again, your left eye looked lovely and healthy, nice and healthy. Then the right eye, there's a little few changes there that, again, I'm not 100% happy with.
Oh, right.
So it's just those three things together. I'd like to just refer you quite routinely, it's not urgent at all, via your normal doctor, your GP, to the hospital just to get a few things checked.
Right.
Because the hospital will be able to do a few more tests there, and if there's anything wrong with your eye, they might be able to give you some treatment there to stop things from changing. So if it's okay with you, I'd like to do is just jot a few notes down to your GP and send a letter off there.
What do you think it is in my right eye?
Well, I'm not an eye doctor, so I can't, I'm not 100% sure, but I suspect you might have an eye condition called glaucoma. I don't know if you've heard of glaucoma at all.
No, what's glaucoma?
Well, it usually sort of changes at the back of the eye. You have nerves at the back of the eye, which is what you see with. And sometimes those nerves can become slightly damaged. And that's what I think might be happening with you. It's very, very early stages at the moment. So basically, the quicker I get you to the hospital, the quicker they'll be able to do something about it.
It sounds will I go blind?
It's very early stages at the moment, so I think if you do need treatment and the doctors put you on treatment straight away, the chances of you going blind are very, very small indeed. And it's only affecting one eye at the moment, so the left eye, as I say, looks nice and healthy, the pressure in the eye is fine, the test where you counted the dots, the lights was absolutely fine there. And usually with this eye condition, what happens is they just give you some eye drops to keep it under control, so you might have to put some eye drops in the right eye just to keep things under control. But as I say, it's only early changes at the moment, very early stages, so shouldn't be a problem.
In my job, I have to drive quite a bit. Will that affect my driving? Will I have to report that?
At this moment in time, the best thing to do is to go to the hospital, and they'll be able to advise you whether you can drive, etc.
Yes.
As I say, it's very early changes, only affecting one eye, so it's unlikely to affect your ability to drive at the moment. So I wouldn't be too concerned.
But do you think that it is treatable? I won't lose my sight.
Absolutely. It's an eye condition. If you do have glaucoma, it's an eye condition that's treated commonly with eye drops, as I say, and most of the time the eye drops keep the condition well under control.
Well, thank you very much for that.
So I'll just get the letter done for you.
Thank you very much.
You're welcome.
If you think your patient has glaucoma and requires further referral, then it is a good idea to explain to the patient the results of your various tests. Tell them that glaucoma is a condition that affects the nerve at the back of the eye and that it has the effect of reducing their peripheral or their side vision, so that often they are unaware that there is a problem. Do remember that most cases of glaucoma are picked up incidentally during routine sight tests, so your patient might be a bit surprised that further referral is required. Tell them that in some cases the condition is caused by high eye pressure, but not always so, and that you're referring them to the ophthalmologist via the GP, and that the ophthalmologist will probably repeat some of your tests to confirm any suspicions. Advise them that if they have glaucoma, usually it can be controlled with eye drops, and that the eye drops are used to try and prevent any further nerve damage. Glaucoma is an irreversible condition, so any existing nerve damage cannot be reversed. It is also important to tell your patient that you're not making a definitive diagnosis, but that you merely suspect they have the condition, which is why you are referring them for further investigations.